It felt like surreal, like something out of a movie.
And then they put me into the ICU. After that, it was kind of a blur.
Just like, we just ran out of money.
More than 400,000 American lives have now been lost to COVID-19.
Tonight, there is growing concern at this hour over a possible outbreak of a mystery virus.
The only confirmed case in the U.S., a man in his 30s who flew to Seattle from Wuhan, China, the outbreak's epicenter, last Wednesday.
This morning, the CDC announced confirmation of the second case of novel coronavirus in the U.S.
A new warning from the State Department urging Americans to reconsider travel to all of China.
Probably by mid-February, everyone was sort of on board with the fact that we were seeing this emergence event take place in China that was going uncontrolled and seeing the devastating impact in other parts of the globe. I think by March, we were sounding the alarm bells.
We will be suspending all travel from Europe to the United States for the next 30 days.
It's been 5 days since I was tested. And I called the doctor again today. They said they don't have my test back.
We missed the mark in several ways. We were very slow to think about contact tracing. We were very slow to think about interventions like increased social distancing. There was no sort of federal mandate to get this virus under control.
Americans should be prepared for more than 100,000 deaths before we get through this.
You open up, could lead to death, and you're right. But you know what? Staying at home leads to death also.
I remember sitting down with my department chair, and we were talking about the other hospitals in Queens, and they were literally collapsing. Like there was gridlock on the floors. The emergency room was exploding.
All these patients here sitting out in the hallways because we are full. We're also setting up a couple tents outside our hospital that serve as an overflow for these COVID-19 patients.
There were people waiting in the waiting room, and the EMS had no place to bring anyone because every hospital was full. That is like pretty much as close to the definition of health system collapse as you can get. Those first few months were just, I mean, everything was saturated. The hospitals were saturated, emotions were saturated, everyone's work schedule was saturated. Like you had no time to breathe, no time to eat, no time to think, no time to even feel your emotions.
Given that the CDC did not have as much of a voice, it created essentially a whack-a-mole situation where some states implemented interventions, others didn't. And then we consistently saw the virus move around this country and wreak havoc.
Since Memorial Day, Texas has seen a 36% increase in COVID-related hospitalizations.
I mean, we had our dream home in May, right? We purchased in May, thinking of getting married in July.
It was the weekend before I went into the hospital. I noticed where my lungs were a little heavy, and I had a real bad attack, and my oxygen dipped down into the 70s. And when that happened, it really scared me because I couldn't breathe at all. It was like if I was underwater.
Like I remember when the first time he got intubated, the next day I knew he couldn't talk. And so he got a touch screen and he formed a heart, and that's the only thing I received. And it was just really hard, and I would just beg the nurses to go hold his hand.
This morning, Arizona ICUs nearing capacity, filling up with COVID patients as the expected death toll is revised upwards.
Texas with 5 straight days of more than 100 deaths. Its hospitals under stress.
Dan's an ordained minister. He's the one that married us at the hospital.
So they got us a cake, they got us the flowers.
It's more than we ever would have thought or imagined or even expected. You know, that day, it clicked in me. It's like, hey, look, I still have a life. I'm making a promise here, and we're doing this. It really did switch something in me. It's like, hey, look, I have to get through this. It was right then, after that, it was just like a steady uphill in my healing.
The unofficial last beach weekend of the summer.
As we go on the other side of Labor Day and enter into the fall, we want to go into that with a running start in the right direction.
Anyone who's responsible for that many deaths should not remain as President of the United States of America.
Yeah, we love you!
The president tweeting today about leaving Walter Reed, telling the American people, don't be afraid of COVID. Don't let it dominate your life.
This is not just, immune compromised people. My healthy 53-year-old mother, her life was cut short within 2 months of having this virus in her body.
On Saturday, Wisconsin logging nearly 2,900 new cases, a record high paired with record hospitalizations and deaths this week.
Polling places have never looked quite like this.
So historically, when we would vote in a classroom, this year we wanted the gym.
Every voter, we will wipe out.
Overnight, Joe Biden bounding on stage, declaring victory and assuming the title of President-elect of the United States.
The people of this nation have spoken.
We've seen over 2,000 deaths in the United States in a single day. We're seeing around 200,000 cases in a single day. Our baseline is unacceptably high. I'm really afraid over the next month, in between Thanksgiving and Christmas, we're going to see some major surges.
It was our intention to stay open as long as we could to keep people employed and also, uplift our community because our food is, kind of a beacon of the neighborhood. And I think people found comfort in knowing that we were still open.
Business owners in Los Angeles fired up and fed up, protesting against new stay-at-home orders now in effect there as ICUs fill up.
This is our former dining area. You can see now it's basically just become like a packing facility for all of our to-go and takeaway orders.
Restaurants represent an environment where there's greater chance for disease transmission. They often have poor ventilation, people have to eat without their masks on, and we've seen many examples either in bars or restaurants where super spreader events have taken place.
We're here inside the Golden State. It's definitely been a really tough week informing our staff and all of our customers about our plans to close.
Unless sort of like an angel falls out of the sky and drops a pile of cash on us, January 4th will be our last day.
The push to get more Americans vaccinated quickly. New York City opening so-called vaccine mega sites, trying to meet the historic demand.
Getting the vaccine is very emotional for me. We've all been dealing with this for what seems like an eternity. It's probably been 9 months since it's really hit hard here.
Frustration is mounting over a campaign that's far behind schedule, officials slamming the federal government's vaccine rollout strategy.
We've got to organize this like the national emergency that it is. We've sat back and assumed that somehow creating the vaccine was all we had to do.
Our plan starts with mounting an aggressive, safe, and effective vaccination campaign to meet our goal of administering 100 million shots in our first 100 days in office.
This is not the last time that an emerging infectious disease will have impact. We have to be vigilant, both in the ways in which we identify new viruses and stop them at their source, but then also building better infrastructure within this country to respond.
This is a symbol and an actual step to the first step towards going back to normalcy.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.